Hello and welcome to the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program, and we are here to talk to you about all things low back so that finally we can remove the confusion, we can take control of our low back, and we can understand what is going to get us better and what is going to maintain those changes for life. This is the first episode of many to come, and I'm so excited to be speaking with all of you in a different format than we're normally used to. I do a lot of Instagram content, a lot of videos, a lot of IGTV, a lot of pictures, a lot of different things that way, Facebook, YouTube, but I am finally in the podcast realm. We are also recording this as a format to YouTube as well, where a lot of these are going to be posted. And I'm just so excited to reach more people, maybe even more convenient. Now you can listen to me when you're in your cars or on a walk or whatever you might be doing. And I just can't wait to further spread information about low back related issues so that you can learn how to fix yourself. So, why are we talking about low back issues? Why am I making a podcast just about low back issues? Low back pain is the number one disability in the world. The number one. Now, 80% of individuals alive will suffer from low back pain at some point in their lifetime. 80%. That is an enormous percentage. And this is a serious topic that we need to be discussing. Now, why is this such a problem? Up until this point, we know that, simply put, it is a misunderstood, poorly managed, and a broken system that has led us to where we are today, where this is the number one disability, and so many individuals are struggling to find help. Now, low back issues are so detrimental because not only does it affect you physically, it affects you mentally. Whether you're having a good day where you're feeling, hey, I have less pain today, I'm feeling fantastic, it might still make you hesitant to go out and do the things that you love because you don't want to risk making it worse the next day. So even though we might be feeling right, it can affect us mentally. It has so many influences on every facet of our life, and we're sick of it. And I'm here to attempt to make the biggest difference that I possibly can with low back issues because I'm so passionate about them. I care about individuals who are out there struggling to find help. I know how frustrating it is to feel like you've tried everything. You've seen 3 different chiropractors, 3 different physical therapists. You've seen an orthopedic. You've tried injections. You've even tried surgery. I have heard it all. I've had clients who have tried it all, and I understand the struggle. So please, as we continue to grow together, as we continue to learn more about low back issues, do not hesitate to reach out for help. I'm here for you, and I'm here prepared to invest into you to help you find a solution. Now, the big point of today's initial launch podcast is to go over my top 10 myths of low back pain. These are myths that individuals are told all of the time. All of the time. I have clients all around the world who are told these same myths. And sometimes the things that we're told are just as harmful as maybe an improper procedure or an improper treatment. Our words matter, and our words can be detrimental to someone's success. So I want to make sure that you are aware of the top 10 myths of low back issues so that you do not fall into these traps, so that you are educated, so that you know better if one of these topics come up and you can take action, you can take control, and you don't fall into these traps that are plentiful out in our healthcare systems. So let's get into it. Myth number 1, one leg or one hip is shorter than the other. We hear this all of the time. This is a rampant myth that the reason for your low back pain is because you got a shorter leg than the other. Well, research shows that about 90% of individuals walking around have an uneven leg or an uneven hip. So you tell me, is that abnormal or is it normal to have an uneven leg, right? I have an uneven leg. You probably have an uneven leg. We're all made differently. We're all uneven. If you cut me down and you compare the right side of my body to the left side of my body, I can guarantee you that they're not going to match. That's just the way that we're born. So the reason for your low back pain is not because one leg is shorter than the other. Could it relate if it's severe? Sure, it could relate if it's very, very severe. But I've not had a single client where they got better because we fixed their leg. That's just not going to happen, okay? You're made the way you're made. The second myth, you need an MRI or an image in order to see the problem. That is not true. A majority of findings on an MRI for low back related issues are asymptomatic, meaning that they're not causing pain. There's many studies that show a vast majority of individuals walking around have disc herniations or have disc bulges on an MRI, but they don't have any pain at all. So is that truly the problem then? Should we make it a problem? And if we're taking these images, are we just finding unnecessary things to blame? Or maybe scary reports to give these individuals to make them feel as though their condition is worse than it actually is? Or to feel like more things are wrong with them than there actually is? Most of the time, that's what's occurring. Individuals are getting unnecessary imaging because they feel like they need to see the problem. And very often they're going to get a scary report. They're going to see a lot of things that don't matter, and it's going to cause further confusion. And it's going to push them towards invasive procedures because most often when a general practitioner, an orthopedist, or a neuro, whatever, gets an image and it shows a disc bulge on it, a herniation, they're going to say, yep, we need to go forth with some injections, some drugs, and if those don't work, we're going to surgery. I hear it all the time, and it happens all the time. So we don't want premature imaging. It's going to confuse us, and it's going to just be another extra expense that you could apply towards something that's going to get you a lot further. Myth number 3, out of alignment. You're out of alignment, and that's why your low back hurts. Well, what does that even mean? I'm probably out of alignment for all I know. Out of alignment is a vague term. We don't really know what it means. Are they talking about bones being out of place? Are they talking about, one hip being higher than the other? What does that mean? If we formulate this obsession of always need to be in alignment, and if we're not in alignment, then we're at risk of injury, or we're at risk of making things worse, or that if we're not in alignment, we're just gonna feel bad no matter what. It paints this picture that you have to be perfect all the time, or that you can't have just normal aches and pains. You can't have normal restrictions that you can manage on your own, that you need to be in perfect alignment all the time. Can cause individuals to obsess about the way that they feel, to obsess about their pain, and can really get in their heads and make things worse. So I can guarantee you're not out of alignment. Sure, can things function better and can you feel better? Yes, but you're not out of alignment. That is not a reason for your low back pain. Number 4, a disc herniation, when it happens, it won't heal. You need surgery. That is a big time myth. Disc herniations can and will heal on their own if you have the right plan. There is a large study performed that showed that 97% of individuals that pursued conservative care or proper rehab program for their disc herniation were able to recover without surgery. 97% with the right plan, without surgery, recovered from disc herniations. You do not need a surgery to remove that disc herniation. It can heal on its own. They do heal on their own all of the time. The number one reason why clients come to me for my online program and for online coaching is because of disc herniations and being told that the next step is surgery. You're going to need an injection. You're going to need this. You're going to need that. Or you're just going to have to deal with it. Or that you're just going to have to live with it. I hear these things all the time. And it's not true. That is a myth. Your discs can and will heal. Myth number 5. Adjusting will put things back in place. Now, I'm a chiropractor. You're probably shocked that you might be hearing this from a chiropractor because often you'll hear chiropractors or physical therapists say that you need to be adjusted to put things back in place or put things back in alignment. Well, when you receive an adjustment or spinal manipulation from a chiropractor or a physical therapist, things are not being put back into place. Bones are not moving. They're not moving your bones, they're not moving things around. That would be quite scary if our body was so loose and so lax that you could easily manipulate the position of a bone. That would be quite frightening. Now, we do manipulate positions of joints. We improve joint mobility. We put motion into joints, but we are not moving bones around or moving things into positions. So you do not need things adjusted back into place in order to resolve your low back issues. Myth number 6, it's degeneration. It's just degeneration. It's arthritis. There's nothing that I can do about that. It's just the way that it's going to be. My doc told me. Degeneration is called getting older, okay? If you see degeneration on your spine, that's called gray hairs of the spine or wrinkles of the spine. Just like we get gray hair on our head, we get wrinkles around our eyes, around our cheeks. The same thing happens to our body, right? It only makes sense. Your spine is not going to look like you're 16 years old through your 60s, 70s, and 80s. That would be wild if that was the case. So we are going to see normal age-related changes on your imaging within your spine. That is normal. It happens to everybody. Degeneration or degenerative disc disease is not the reason for your low back pain. Myth number 7, that you need to rest your low back in order to get it better. You need to calm down. You need to take a breather, stop squatting, stop deadlifting, stop exercising, stop running. You need to rest. Well, we find over and over again that evidence supports the fact that rest is not helpful for low back pain. Numerous studies show that movement and maintaining normal activities is key for overcoming low back related issues. You need to move. Now you need to find the right movements, right? Because movement is medicine. There are bad medications for certain conditions and there are good medications for certain conditions. So you need to find the right movement. But generally speaking, rest is not helpful for low back pain. It can make things worse. It can cause deconditioning and it can cause you to become more fear avoidant of certain tasks. So rest is not a solution. If someone is telling you to rest low back issues, it's time to find a new doctor. Myth number 8, your low back pain is because of tight hamstrings or weak glutes. Now, is this because you don't have tight hamstrings or because you don't have weak glutes? No. You might be able to improve those areas for sure, but I've never seen a single individual that I have worked with where we were able to resolve their disc herniation or sciatica-related pain by stretching their hamstrings or getting their hamstrings looser or strengthening their glutes. Sure, is hip stability or glute stability part of their program? Sure, it normally is. But is it as simple as, oh, your glutes are weak, that's why you have low back pain? No. It's not that simple. It's not that 1 + 1 = 2. That is a classic old school kind of therapy thing that people are told, or it's because you're in tight hamstrings. No, it's just not. Okay. Let's look at more global things. Let's look at more movements. Let's look at your movement patterns. Let's assess the function of your low back. We need to do all of these things so we're not just blaming your low back issues on weak glutes or tight hamstrings. That's not the reason. Myth number 9 is because you have a weak core. Your low back pain is from a weak core. That's not the case. I have worked with professional fighters, professional football players, professional golfers, professional weightlifters, people who have incredibly strong cores. And they have low back pain, and they were told by other providers that the reason for their low back pain was because they had a weak core. But they're doing planks for minutes on end. They're doing very difficult movements with their core, and they're able to withstand that. They don't have a weak core at all, but they're still told that, and they're still led to believe that. And that also leads to a lot of confusion because they feel like, well, I'm doing all these things. Maybe I just need to do more. Maybe I need to keep doing core movements every single day in order to get better. And that's just also not true. There's so much more going on than that. And once again, research supports that a strong core is not related to low back pain. That is a myth. Now, with my programming, do we sometimes further implement core stability work or core awareness or core strength? Yes, of course we do. But I will never, ever tell anyone that their low back pain is because of a weak core. And if they just strengthen their core, it's going to fix the low back problems. That's not true. That's a myth. And finally, myth number 10, that your low back pain is because you need better posture. That is not true. We know that posture is dynamic. Posture is always moving. There's no way to tell someone that one particular posture is going to be bad for them because you don't know how long they're going to be in that posture. So I have individuals all the time that ask me questions about, hey, I know that my posture is bad. I need to improve it. That's the reason for my low back pain. But we get to talking and I hear that they're sitting in their chair, not moving for 8 hours straight. Well, I don't care how you're sitting in your chair. If you're sitting in any one position for 8 hours straight, you are going to feel bad afterwards, no matter who you are. So the focus here is not your posture, it's how long you are in that posture. If you are frequently alternating your posture every couple minutes and you're moving as much as possible, then that's not going to be a problem. Your posture is always changing. You want to move as frequently as possible. And if that means getting up and taking a break and walking around the office or walking around your yard or your house or your neighborhood whenever you can, that is going to make a significant impact throughout your day. But your posture does not need to be fixed. It does not need to be changed. You just need to move more frequently. So the best posture for you is the one that you're in for the next 5 minutes. I want you to remember that. Listen to that again. The best posture for you is the one that you are in for the next 5 minutes, because movement is king. Don't obsess about your posture. Don't just try to do posture correcting exercises, although they may feel good, although they might be mobilized in different areas. Your posture is not the reason for your low back pain. There are many other things that we need to address and implement so that you can have an effective strategy towards a low back pain free life, so that you can get back to the things that you love, so that you can have a plan, so that you can remove that confusion from all of these myths that people are told every single day, so that we can truly learn how to take control of these issues and get back to the lives that we want to live. If you enjoyed this podcast and you learned something from it, please like the video, rate the podcast so that we can build up some reviews and we can reach more people out there that are struggling to find help with low back issues. Thank you so much for listening, and don't forget, if you are struggling with low back pain and you're tired of existing in the gerbil wheel of the healthcare system that sometimes we are stuck in, let me know. Reach out for help. I coach clients all over the world with low back issues, and you can go to my website and submit an application so that you and I can meet. We can put a plan together and we can invest in each other so that we can get you back to the life that you want to live. Have a fantastic day.